Hi friends, what is hematoma block? It is much of a debate whether you should do it or not. Can it increase the chance of an infection into a fracture? It's usually used for the distal radius fractures, one of the commonest fractures in elderly, fresh fractures. Aim, it will assist in painless reduction. Patient is in supine position with the fracture by the side of the limb, fracture limb on the side of the limb of the body. Sterile technique, not to be done in open injuries. Evaluate the skin first. Ease out the patient. Give a systemic analgesia. Monitoring should be done. Paint and drape the area. Prepare it. Have a good C-arm facility. Small bore needle. Infiltrate the subcutaneous tissue with some anesthesia. Enter with a wide bore needle in the fracture gap. Aspirate. Blood comes out with hematoma. Blood with fat drops confirms it. Inject 5 to 10 ml of anesthetic agent, 0.5 or 1% of lignocaine with epinephrine. It can be easier with a large bore needle once you have injected that area with a smaller bore. During the block, the patient can be anxious. Muscle spasms can be common. Give decent time to adapt to the situation. Inform the patient all the steps: small bore needle, large bore needle, aim of reduction, C-arm, OT draping. With pain relief, the muscles will be more relaxed and the fracture reduction will be easier to carry out. There might be teachers of old school thought who might not agree with hematoma blocks, but yes, there are areas and the literature that talks about it. The hematoma block. Thank you very much.